Hello everyone, I'm Dr. Vincent Zhong from the School of Public Health and Primary Care, Chinese University of Hong Kong. So today I'm going to talk about the main clinical implications of our systematic review of qualitative evidence on the non-specific effects of acupuncture and sham acupuncture in clinical trials from the patient's perspective. So what is non-specific effect of acupuncture and why should I care? So probably we have to have an overview on what is specific and non-specific effect for acupuncture. So for the specific effect, in acupuncture terms, this is actually the procedure of needle insertion and manipulation. These are therapeutic actions that are theoretically derived and are unique to be causally responsible for the beneficial outcome. On the other hand, non-specific effects of acupuncture treatments contribute to beneficial outcomes from anything other than the specific treatment components. So previous study has shown that non-specific effect actually generates significant therapeutic impact in clinical practice on top and above spontaneous improvement, natural history, and regression to the mean. If you look at the bar chart on the right-hand side, you can see that as compared to only providing usual care to the patient, the acupuncture plus usual care group has much higher therapeutic effect because, first of all, actually for the both groups, actually the patient will experience usual care impact, spontaneous improvement, natural history, and regression to the mean. And at the same time, for those who are receiving additional acupuncture, they will benefit from the non-specific effects of acupuncture and the specific effect of acupuncture, and that make the difference. So what are the take-home messages? As acupuncturists or practitioners of acupuncture, how should we enhance positive non-specific effect in acupuncture practice? So first of all, we should manage the main campaign as well as the comorbidities if possible. We should perform holistic and traditional diagnosis before performing acupuncture. We should practice empathy by listening to the changes in symptoms reported by patients as the treatment progresses, including both physical and emotional issues. In terms of communications with the patient, we should foster a positive attitude regarding the efficacy of the treatment, including a high expectation of success. We should also provide lifestyle modification advice and engage the patient in performing the following. First of all, discuss the ways to implement healthy lifestyle modification with acupuncturists and provide them verbal feedbacks to the acupuncturist during the treatment. So these are some of the findings we derive from these systematic reviews. And if you're interested in how we actually come up with the findings, you're welcome to look at the full text. And if you want to know even more about how we actually validate the findings, you may find the following papers of your interest. Thank you for your listening.